will be doing IV push. I will check my doctor's order with my MAR. The doctor ordered Zofran 4 milligram IV push now. Okay, I will check with my MAR, and I'm checking for allergies. I'm checking for the patient name. I'm checking for the medication, which is Zofran 4 milligrams IV push now. The route was IV push. Time is now. I checked for allergies already, and I checked for the patient name, and the patient don't have any allergies. Okay, I went on and did my math problem, and the bottle of medication has 40 milligrams over 20 ml. So I do my 4 milligrams divided by 40 times 20, and that gives me 2 milliliters. Okay, so I got my mark and my medication. Zofran is for nausea and vomiting. That's the dose. The dilution is not required in adult or pediatric patient when given as an IV injection. Compatibility, it is compatible. Let me see what's hanging, which is D5. So in the book it says it's compatible. D5W, NS, D5 half normal saline, D5, NS, and 3% sodium chloride injection. So it is compatible. This medication, I'm checking the dose. It says a single 4 milligram dose over at least 30 seconds, 2 to 5 minutes is preferred. So I'm going to give 2 milliliters over 5 minutes. So I'm going to give 1 milliliter 2.5 minutes. And I'm going to get the other milliliter at 2.5 minutes. The total out to be 5 minutes. So this medication is a safe dose to give. Okay, I'm checking for my contraindications, hypersensitivity to Zofran or any of its components. I'm checking what I'm going to monitor closely. I'm going to monitor for orthostatic hypertension. I'm going to monitor the EKG EKG, because the patient is recommended with patient with electrolyte abnormalities, CHF, or a patient taking other medication that can lead to QT prolongation. I'm going to monitor the signs and symptoms of hypersensitivity reaction, such as chest pain, dizziness, dyspnea, fever, flushing, hypotension, nausea, and itching. The common side effects is to report diarrhea, fever, and headache. I don't see any labs that have to be monitored, but okay, I got that. So I am going to, this is what I'm going to do, assemble all my equipment. I'm going to write on my label. I'm going to write on my label the patient name, the medicine, the amount, the time, the date, my name, the time is going to end. The date is going to end and the time is going to end. Before I touch the medication, I am going to wash my hands. Okay, after I wash my hands, I am going to take an alcohol prep and wipe the top of my medication off. Okay, I am going to pull back 2 milliliters of air on my syringe, and I am going to go in, flush the air, and pull back 2 milliliters of solution of the medication. Okay, and then I am going to close that back up, put my label on, and I am ready to go see my patient. Okay, I got my MAR. Hello, my name is Arletha. I'm a nursing student with Meridian Community College. Can you state your name and date of birth for me. And while I'm looking at the armband and the MAR, I am comparing the name and date of birth to my MAR. Okay. Do you have any allergies? He said, no, he doesn't have any allergies. Okay. After I do that, I am going to wash my hands. Okay. After I wash my hands, I am going to explain the procedure. I am going to explain that this medication is Zofran, and the doctor has ordered Zofran 2 milligrams IV pushed, which is going to go through your IV line. This medication is for nausea and vomiting. And when I explain the medication to him, I'm going to let him know that also you may have some diarrhea, headache, dizziness, and if you have any chest tightness or itching, you just let me know. And before you get up, also let me know, because this medication can drop your blood pressure. Okay, and after I do that, I am going to check my IV site. I'm checking for any redness, swelling, leakage, any sign of infiltration. I am going to lower the the primary fluid to see good blood return. And once I lower to see good blood return, they let me know that the IV is good, painted. So after I do that, it's time to give my medication. I am going to clean the port closest to the patient for 30 seconds. Okay, 30 seconds. As I do that, it's time to give my medication. Drop it in there. I hook my medication. Okay. All right, I clamp and I push 1 milliliter of this medication. I unclamp. I am going to monitor for 2.5 minutes, starting now. Okay, I'm gonna get my other 1 milliliter, clamp, and push. Unclamp, and start my 2 minutes, 2.5 minutes. Okay, after that, I unhook. I'll unhook it, and I monitor the patient for any signs and symptoms of an adverse reaction to this medication. And again, I explain to the patient, if you're going to get up, let me know, because it might drop your blood pressure. I explained that this medication was for nausea. I explained to him that if you're having a rash or itching, just let me know. Also, if this was an INT, I would put on my gloves. I will wash my hands. I will wash my hands. If this was an INT, I will wash my hands. I will put on my gloves. I will cleanse. I will clean the port. If it was an INT, I will clean the port for 30 seconds. And then I will flush. I will flush it. Then I will give the medication. And then I will flush it again. And then I will still monitor the patient for any adverse reaction with this medication. And I'll give it in the push-pause method. This medication was stat. So I will chart on the MAR, the medication, how the patient tolerated, the route of the medication, which was IV piggyback, Zofran, 2 milliliters over 5 minutes, the time, and I will sign my name, because that will be my documentation.